So welcome to BioBites. I'm Jessica Frank. I'm the Biomed Program Manager at the Marion Institute. If this is your first time to BioBites, BioBites is the Marion Institute's monthly virtual educational series. BioBites connects you with some of the foremost experts in biological medicine today, speaking on key topics in holistic health and medicine. Today's topic is Atlas misalignment. It's a common ailment that many people are actually unaware that they even suffer from, or they're unsure how to address it. So helping us answer these questions today, we have Dr. Martin Hart. Dr. Hart has earned a reputation for being one of the leading healthcare providers in the alternative healthcare field. He's a board certified chiropractor trained in kinesiology, homeopathy, functional medicine, of course, biological medicine, plus acupuncture and natural medicine, detoxification and positive psychology too. He's the owner of Keystone Total Health in Columbia, Tennessee. I strongly suggest you check out his website. It has many resources available, videos, educational articles, and more. So without further ado, we'll click some buttons and we'll hand it over here to Dr. Hart so we can get underway with his presentation.
Thank you, Jessica, so much for that wonderful introduction, by the way. And thank you guys again for having me back on BioBites. I'm excited to present today. It's always a pleasure working with you. All right, I'm going to share my screen with everybody here. Okay, so that should all be set up really wonderfully there so you can see. So today we're talking about the weight of the world, Atlas misalignment, and your health. So I always like to give a brief introduction about what we're going to be talking about. So when you're going to work with the Atlas, we're getting your head on straight. So we're going to talk about what is Atlas misalignment, talk about how it impacts your health specifically, especially if you have a chronic illness. We'll look at common conditions associated with the Atlas, symptoms if you've got the misalignment. We'll look at what causes it, how do you fix it, and then I'll take some questions at the end. So Atlas misalignment. The atlas, it's the top bone in your vertebra, right? The very top of your spine sits right there. We all maybe know the Greek mythology of Atlas holding up the globe, right? Or holding up the world or universe. They named that because our atlas holds up our globe, which is the main part of our internal world, right? So that atlas is held in place by connective tissue and muscles. Most of the rest of the spine is held in place by bony connections as well, called facets. Those facets don't let the bones get too far out of place. But that atlas is different, right? Because it's just connective tissue, it's just muscles and ligaments holding it in place. They can actually shift and stay shifted. You can see that on MRIs, you can see that on X-ray scans, right? You can palpate that if you're a physiotherapist or a chiropractor. And so when that shift and stay shifted, we'll talk about what that does to the body. But one of the roles of the atlas, it's a very much a neuromuscular regulator. So it tells the body, it tells the brain what the rest of the body is doing. Has all these little muscles called suboccipital muscles that attach the atlas to your skull. Now, those little muscles are actually more nerve fiber than they are muscle. Okay, so when that atlas is pushed out of balance, that's essentially sending static back up. And so the brain can't really tell what's going on with the spine. I can't tell what's going on with the rest of the neuromuscular system, all your muscles and joints. Its job is to send that feedback to the brain. Now, it's also a fulcrum for the TMJ, right? For that jaw point. So fulcrum is like when you've got a hinge, okay, that moves. Well, that elbow here would be that fulcrum. That's a thing that happens with our jaw when it opens and closes. We think that fulcrum is at the TMJ joint, but actually from a physics perspective, right, an engineering perspective, it's at the atlas. Your fulcrum is right there. And so when that atlas is misaligned, it totally changes that TMJ structure and it changes the dynamics of that opening and closing. It does a lot more than just keep your head on straight. Okay, so the atlas and chronic illness. It's a major roadblock for the body's information superhighway. So as you can kind of see our brain picture here, when you see that brainstem coming down at the base, okay, that has to go through the brainstem, and the spinal cord have to go through the atlas. There's a little hole in there that cord goes right through, okay? And so when that gets shifted, that creates a major roadblock for that information that has to travel from the body through the spinal cord to the brain and then back out through this brain, spinal cord, and nerves. Okay, so when that's shifted out, it causes a major roadblock for all that information. So if you've got an injury in your knee, but your atlas is misaligned, it's going to skew all that information that's going in and out, right? It's like major radiostatic for the rest of the body. Another thing it does is it slows blood flow supply to the brain. Not only blood flow going in to supply all those nutrients and those oxygen, but also the toxins coming out, right? All the broken down material and junk coming out. And so when that gets shifted, because those arteries and veins go through the sides of your atlas into the brain. And so that really slows the blood flow. And you can see that on upright MRI, especially. You can see how much that gets stagnant and slows the flow down, called venous insufficiency. Now, the other part of the flow that happens, it gets blocked, is cerebral spinal fluid flow. So your cerebral spinal fluid is actually what nourishes, hydrates the brain, and then clears the gunk out as well. So the blood to the brain gets filtered out, and then it goes into cerebral spinal fluid as part of that. And the brain produces some of that in the ventricles. Now, that flow that needs to happen and wash over the entire brain, wash in and out of the spinal cord, up and down the spine, that gets massively inhibited by an atlas misalignment. When that atlas shifts, what actually happens is your brain dips down into your neck a little bit, and it restricts blood flow, and it puts pressure on that brainstem. Now, your brainstem, what does it regulate? It regulates your breath rate, regulates stress levels, movement, digestion, blood pressure, blood sugar. All those unconscious things that our body needs to do to regulate itself are suddenly affected just by a little bone in your neck being shifted a couple of millimeters. It doesn't take much, just a few millimeters that you may not see with the gross eye. Like, your neck does not have to be completely crooked. It's just a little shift there that happens. So I talked about how it impacts the entire musculoskeletal system. So research has shown that an atlas misalignment can actually create low back pain. It can cause your disc to degenerate faster in your low back. It can cause knee pain, hip pain, foot pain, because it's throwing off the entire gait, right? So you've got the master regulator up here out of balance. Everything else is going to be shifted incorrectly from there on. I talked about the jaw earlier. It can even impact the jaw. Because the way it puts pressure on our brainstem, but also sends static feedback to the brain, it dysregulates our HPA axis, which is our main hormonal way of dealing with stress. So suddenly you're more reactive to stress. Your hormones are imbalanced, right? And so this can cause both stress hormones to be imbalanced, but also like sex hormones, testosterone, estrogen, progesterone can all be out of balance because your atlas is misaligned. It's also very important for balance and coordination, right? So when we're looking out in the world and we're trying to create equilibrium, your atlas helps us do that by regulating inner ear motion, eye motion, and telling the brain where the body's at. So if your body's trying to regulate its eye coordination based on where your feet are on the ground, but it's getting mixed messages about that because your atlas is out, then suddenly you're going to be imbalanced. You're going to have a hard time. You're more likely to have vertigo, disequilibrium. Benign positional vertigo can even be partially caused by the atlas misalignment. So I want to list a couple of common conditions that have atlas misalignment as one of the factors leading to it or contributing to it. So craniocervical syndrome is one. That's where people get a lot of head pressure, headaches. Actually, that's actually what we would call the medical diagnosis for atlas misalignment in Western medicine, would be craniocervical syndrome. Okay, so that one causes fatigue, brain fog. The list is huge on that front, which we'll cover a little bit more later. Multiple sclerosis. They've actually found that physical accidents are a big contributor to multiple sclerosis, causing atlas misalignment. The research on that is huge. They've done thousands and thousands of participants in the studies on that, showing how much it relates to the atlas, and improving atlas coordination and atlas alignment helps MS. Migraines, right? Any headache really, but especially those intense migraines. Anxiety, depression, fibromyalgia, right? Total body pain, the unexplained cause. I actually find that relates to the atlas misalignment because the way it affects the rest of the neuromuscular skeletal system. Trigeminal neuralgia, which is also called tic douloureux. That's where you have intense pain kind of coming out of this region, looks like a hand display. So people get pain moving all this way in the jaw, ear, sometimes hearing loss. That one's very debilitating for people. They found that's actually atlas misalignment putting pressure on the cranial nerves. Hypertension. This was a really cool study. Okay, they took patients with high blood pressure, hypertension. They adjusted their atlas, and then they monitored and they compared this to blood pressure drugs, and their blood pressure continually went down. And as long as their atlas was in alignment, their blood pressure stayed down. That's a huge factor for people who have difficult to control blood pressure issues. Vertigo, which is another kind of word for dizziness, where the world is spinning around you. Other various pain syndromes, chronic pain, right? So any pain that's lasting longer than 3 months, we consider a chronic pain syndrome. Okay, so chronic pain syndrome, central sensitization, reflex sympathetic dystrophy, all those sort of things has atlas misalignment as a component. Whiplash. A lot of times when we get whiplash, right, in a car accident like that happens, or other regions, we'll work on the lower regions that hurt, but we'll never reset the atlas. So what I find in those people who have chronic whiplash and never quite get better, nobody's fully set their atlas again. So the rest of the vertebra and the rest of the muscles can't really align themselves and heal because this first one, the foundation of the spine up high, isn't set correctly. Tinnitus, ringing in the ears. This can go from very mild, right, to just a mild ring or intermittent, so it's off and on, to intense full-blown blaring. We find atlas misalignment as one of the major causes of that. And then back to the jaw, the TMJ syndrome. So if the fulcrum point, if the actual point of where the opening and closing is based off of becomes misaligned, and the way the atlas would usually misalign is it's going to shift and rotate and then sometimes raise or tilt, right? So if it tilts and rotates, suddenly the TMJ, which needs to open evenly, right? Well, suddenly if that axis is rotated, or atlas is rotated, suddenly it's going to open awkwardly, and you're going to get one side that's going to get wear and tear and pain and tight muscles, etc. So that's a big one, the TMJ. Okay, so those are some of the conditions we find associated with it. So more like maybe diagnosable conditions. But what are some of the symptoms? How do you know if you have it, right? Or what makes you think you might have it? So especially if you have multiple of these, it's more likely that you are dealing with an atlas misalignment. So vertigo or dizziness, chronic headaches, ear ringing, tinnitus, facial pain, ear pain, dysphagia, which is difficulty swallowing. Okay, that's due to the cranial nerves. Neck pain, syncope, which is another fancy medical term for fainting or nearly fainting, passing out. Sinus congestion, neck crepitus. So if you move your neck around and it makes all this sound, right? You get all that crinkle and crunch in there. A lot of times that's because there's a movement dysfunction. Things aren't moving smoothly and you get connective tissue grinding on against each other and the joints grinding and moving and snapping over each other. That comes a lot of times because the atlas is misaligned. Okay, loss of vision or blurry vision or visual acuity issues. Involuntary eye movement. This could look like what they call nystagmus, which is where you look a certain way and the eye flutters, right? Or it could be where the eyes dart all the time, okay? Now, if you have nearsightedness, okay, where it's difficult for you to see things that are far away, a major component to that is atlas misalignment and neck issues, because we need the eyes and the neck to work in coordination with each other for you to be able to see and adjust consistently. And so with all of our tech neck nowadays and car accidents and poor posture, we're strongly creating visual issues where you see so many people needing contacts and glasses. Big part of that's the neck. Severe fatigue. So if the atlas is misaligned, number one, it's constantly draining energy from the system because we have to manage that. But number two, as all these other systems start to cascade and be affected, all that takes extra resources to manage, right? So that's going to create fatigue and drain on the system. Chest pain. So a lot of people think they're having panic attacks or heart attacks or trouble breathing when it's really there's nerve and muscular issues coming from the atlas. Brain fog, which would be trouble thinking, poor short-term memory, word finding, etc. Head pressure, feeling like your head is full of fluid. There's lots of pressure inside, which is different a lot of times than a headache or head pain. I hear a lot of patients feels like there's water in my head or my head is very full and they're putting pressure on it, right? So head pressure is a big one. Okay, so it sounds like you might have atlas misalignment, right? We're going to have the symptoms, maybe you have some of the common conditions, but what in the heck is causing atlas misalignment itself? So I got a quote on here from D.D. Palmer. He's the founder of chiropractic, which is what my doctorate is in. So he said the three major issues that cause misalignment or subluxations in the spine are thoughts, traumas, and toxins. So by thoughts, he's meaning basically stress. So chronic stress can throw the neck out. It can throw the atlas out. Why? Number one, stress hormones, cortisol especially, is going to weaken the connective tissue and weaken the bones and joints. Okay, so it makes it easier for that to come out. Number two, the tension patterns you're going to hold, right? When you're chronically stressed, we're going to hold a lot of neuromuscular tension. Okay, and that's going to pull it out. So thoughts, stress patterns, etc. Traumas, and he meant physical traumas, falls, accidents, car accidents, etc. can all cause it, right? You can have a car accident, throw it out. Even what I find is somebody bangs their head hard enough on the cabinet. They left the cabinet open and then boom, I can throw an atlas out if we got an issue going on. A lot of times wrestling with the kids, I'll throw mine out, got to get it adjusted. And then toxins. And this is kind of inside of toxins, we can even drive infections, which it talks about. But any sort of toxin, environmental toxin, internal toxin, can affect the neuromuscular system, cause muscle tension, weaken connective tissue, and throw it out of balance. Another cause, what's called craniocervical instability. That's where actually the ligaments, and could be the muscles too, but more so the ligaments get loose. They get too hypermobile. And so it's difficult for that atlas to stay in position because it's too slippery, right? Those ligaments and connective tissue are not securing it. So that can also be caused by continued car accidents. I've had some patients develop that after like 3 car accidents, maybe in a short period of time, where that would cause it. So it can happen genetically also. So like EDS, Ehlers-Danlos syndrome, can cause hypermobility or weak ligaments, and that'll cause instability up high. Different infections, especially Lyme disease. So Lyme disease, the Borrelia loves to eat connective tissue, eats collagen. Okay. And that's what part of our connective tissue, ligaments, all that are made out of. And so when those get weak, it's easier for it to slip in and out, right? It's easier for the smallest things, like, something that I've seen with some of my patients with instability issues or Lyme disease is they take a hard step off the sidewalk onto the street and a little jolted. And because their connective tissue is so weak, it throws their atlas out. We've got to get them adjusted. Autoimmune conditions like mixed connective tissue disease, different ones that affect scleroderma, that affect the soft tissue, affect the connective tissue, can make it easier for your atlas to slip out of place and stay misaligned, right? So we'll talk a little bit more about this as we go. But if you've got one of these issues, how do you fix it, right? How do you deal with it now? We don't just want to know you've got a problem. What's a solution? Okay, any good CEO will tell you that. Don't show up with just a problem for me. Show up with a solution. Well, number one, we need to get you adjusted. We need to restore alignment, okay? Now, as a chiropractor, that's what we're trained in. But with the atlas, because again, it doesn't have those bony connections, it's just connective tissue and muscles, we can't do the typical chiropractic adjustment and expect it to align you. It'll put motion in there, which is good, but it won't keep you aligned. So you have to be trained in what's called upper cervical specific techniques. So I listed a few here that you can look into and see if someone local to you is trained in these. So Atlas orthogonal is one. Advanced orthogonal, which is a derivation of Atlas orthogonal. I was trained in the top 2. They're very good methods. All these are very gentle. Okay. And so it's, if you're used to a chiropractor cracking and popping your neck, this is not that. This is a very gentle, it's almost very anticlimactic about how gentle it is. A restoration of alignment, a restoration of alignment that happens. So Blair is another one, Nuka, and then Activator. So they all use slightly different methods to do it, but they're all very gentle. And you find one that works for you, find someone close who's trained that you like, who can help you restore that. So number one, restore alignment through specific chiropractic adjustments. Some other things to help along that I found very beneficial for people with chronic atlas misalignment. Craniosacral massage makes a big difference. They're all about restoring that cerebral spinal fluid flow, blood flow between the brain and the rest of the spine segments. I found a lot of times they can help someone maintain atlas alignment. Rehab and muscle activation. Okay, so a lot of times what I'll do is if someone is having chronic atlas misalignment and it's not wanting to stay aligned after I adjust it, is I will test all the different muscle groups, the deep neck flexors, the SCMs, the scalenes, the suboccipital muscles, and I'll see if there's some weak muscle patterns there, and we'll do to work to activate them, right? I'll figure out why are they weak, and we'll work to restore that muscle activation so we can create better neuromuscular stability, and then I'll give them some rehab exercises to stretch and strengthen those areas. If you have weak connective tissue, if you've got hypermobility due to ligament issues, whether it's genetic or it's caused by infections or autoimmune conditions or toxicity, there's different nutrient therapy we can do to restore some of that connective tissue. You can look at collagen. Collagen peptides are big lately, especially with all the hair loss with COVID, right? So, but those are great for connective tissue. Vitamin C is really important for that connective tissue healing. Fish oil brings down inflammation. The collagen and the different ligaments and tendons, those all need boron, manganese, and copper to function appropriately. I know in functional medicine, the last 5 or 10 years, we've gotten a little bit of copper phobic, right? A little bit afraid of copper toxicity. But more often what I find is that people just need to put copper in the right place. and part of that is inside the connective tissue. So those are all great nutrients to look at to help restore connective tissue healing. As a long-term thing, if somebody's got a lot of connective tissue displacement or cervical instability, craniocervical instability, we'll look at regenerative medicine. We can do laser therapy, which helps to restore strength to those ligaments and connective tissue. We can do PRP or stem cell injections that help to heal those connective tissues. Is a great way if somebody's got long-term connective tissue healing. If someone has EDS, Ehlers-Danlos syndrome, there's like the Cusack protocol, which is meant for nutrient therapy for helping to strengthen connective tissue. And we want to address the root cause. If you have Lyme disease, if you have mold, if you have mycoplasma infections, right, or an autoimmune condition, we want to address that root cause that's making your connective tissue weak, right? So while you might need to get your atlas adjusted on a regular basis at first, my goal is not to have you in the chiropractor's office 3 times a week for the rest of your life, right? That's not my goal. My goal is to address the root cause, so you only need to get it adjusted when it comes out on the rare occasion, right? So if you've got Lyme disease, you need to address that. If you've got mold toxicity, you need to clear that up. Okay, if you've got an autoimmune condition, we need to quiet the flame and figure out why your immune system's attacking your own body tissues. Okay, I just want to touch on this for 1 second again here. So the key, as I'm talking about what else, is that you start with getting your atlas aligned, then you figure out what you need to keep it aligned, okay? So as my mentors in the atlas orthogonal, advanced orthogonal world always said, get it aligned first and do everything else you can to keep it aligned, okay? Now, it doesn't mean I want you to necessarily stop the activities you're doing that maybe you're throwing it out occasionally. If somebody's healthy enough to do like Brazilian Jiu-Jitsu, but you need to also keep in mind that you're going to need to do a little extra exercises and rehab to keep your atlas happy, and maybe keep a standing appointment occasionally if you're going to be doing activities like that to get your atlas adjusted. Okay. So at this point, I'll take some questions. Jessica, if you want to start on that front, I have some questions I can answer.
That was great, Dr. Hart. Thank you very much.
Thank you.
So what I'll do is I see a few that have kind of themes to them. I also have some new ones that came through from the chat. Also, I do think you're still sharing your screen at this point. So maybe, there we go. We'll go to the, unless you need to refer back to any of those slides, please feel free to do that as well as we go through these questions. So some of the previous questions that were submitted in advance, here's one from RS. When my neck feels tight, sometimes I'll tilt my head back and I'll hear a loud snap. And after that, my neck feels better. I'm not sure what's happening and why. The sound worries me and I wonder what will happen long term. Would a chiropractor, without all of your credentials, be aware of how to work with the atlas?
Yeah, so most of the chiropractors who are traditionally trained in school, we didn't all get a lot of upper cervical. We learned how to adjust the atlas, but not to align it, okay, which is the big difference. So it is best if you find somebody who's trained in one of the methods I mentioned beforehand. But that loud snap pop, my first thought when I hear that, as long as it's not like a tendon, if it's just a snap pop, like when you go back, a lot of times that's more of a gaseous release. So in the joints, we've got little nitrogen bubbles. Okay, when you hear that pop, when like a chiropractor adjusts you, or that snap sound, that's actually the nitrogen being released from the connective tissue, from the ligaments in the joints. And what that's doing is it's decreasing tension and stiffness. Okay, so when that gas gets released, it releases a lot of pressure and stiffness in those joints. So my first point is to anybody, if you do some range of motion and it has that little pop, I'm not worried about it. If you got to do all sorts of weird stuff, to make it happen to yourself, don't do that, please. It's not good for the joints around it. It can cause a little extra wear and tear, lead to basically hypermobility in those other joints. So what I would say is, find a good chiropractor or a good physiotherapist and have them kind of assess your neck and see what issues are going on, and they can help develop a plan on that front.
Awesome, great. The second one that was pre-submitted, can misalignment of the atlas cause neck pain that spreads all the way into the shoulder and a nerve-related heart issues?
Yeah, so when that atlas is misaligned, it'll cause the rest of the spine to start to misalign, put more pressure on the discs, And a lot of times it can create some nerve radiation, or what they call radiculopathy, right, into the shoulders, into the arms, even because all those nerves come out of that same spot. All the cranial nerves or the spinal nerves, they start right at the atlas. So it can even cause chest pain, abdominal issues, etc. You'd want to rule out heart conditions, of course, but those same nerves that come out from where that atlas is at innervate the heart, which can cause some chest wall pain, etc. And so I've seen atlas misalignment cause what was mimicking what they call heart pain or angina, when it was actually just a nerve issue coming from the neck.
Okay. And I know some of these also kind of pull through what you may have already spoken to. So I just want to make sure that all the questions that we've had submitted do get addressed, but I know some of them are um, things you've already spoken to. This next one here also has to do with having Lyme and co-infections. This person asks, I'm wondering if a person who had Lyme and co-infections for many years, who at the moment's in remission, and that had been affecting the atlas with pain and weakness, what can be done to improve the condition today?
Yeah, the biggest point on that one, after like getting your atlas realigned, is healing the connective tissue, right? So the Lyme has ravaged for a lot of people connective tissue and collagen. So you need to go in and start focusing on that collagen peptides, glucosamine, chondroitin, vitamin C, copper, all the nutrients we talked about. You'd really want to focus on healing that connective tissue.
Okay. So someone here also asks, I have scoliosis, and I assume I have atlas misalignment as well. Are there any exercises that you would suggest I could try to alleviate some of the symptoms? And there's
Yeah.
also one in the chat that's also similar about having just or techniques we can do at home to ourselves.
So I actually got to work with one of my mentors in the atlas world. He did a lot of work with scoliosis just by keeping someone's atlas aligned. And he actually found, especially in young preteen girls who are the more predisposed to scoliosis, that if you kept their atlas consistently aligned, that scoliosis would naturally start to restore itself without a lot of the typical scoliosis intervention. So that being said, atlas staying aligned is big. Other than the typical scoliosis stretches they're going to do in the middle of the back, you want to really stretch the scalenes and SCM muscles. So that might look something like holding this stretch like this. So ear down, look up, and you want to really hold that for 1 to 2 minutes at a time. And you want to do both sides like that. Really open that up. And then the other biggies, and this kind of I think goes in general, but is you want to spend a lot of time opening up the pecs. So we want to open this up, open up the front of the chest and shoulder, okay, and then strengthen the rotator cuffs. Spend some time doing external rotations so that you're basically going from here, pumped in, right, to open. We want to stretch so we're on that open front.
All right, great. So the next question I have here is there a cure for cervical spondylitis?
Yeah, that's a
And can
great
you
question.
explain what that is?
Yeah, cervical spondylitis is basically the inflammatory portion of what the medical world kind of calls like age-related spinal degenerative changes, right? So it's where the joints in the spine and the discs in the spine start to degenerate. Some of that's due to age. A lot of that's mostly due to poor mobility, poor motion in the neck and the joints. So we don't, most of us don't take very good care of that. So poor posture, et cetera. So curing it, it's a different word than can you function 100% regardless of it? And that's a definite yes. Okay. By the time we get everything working correctly, I've seen some x-rays of necks that look just honestly disgusting. Like their head's going to fall off, if they move the wrong direction. And we get the muscles working correctly, the joints working correctly. Then regardless of the degenerative changes, suddenly they've got no neck pain, their head functions well, their neck functions well, et cetera. And so you want to get the atlas aligned. You want to work to restore motion, restore neuromuscular integrity to that neck. It's definitely workable on that front. You need to do a little bit of a rehab plan with it, but I've seen people get restored to full functionality regardless of cervical spondylitis.
Oh, that's awesome. Oh, that's great. So I'm looking now towards the chat. So I'm going to begin here with Todd's question. Does atlas misalignment also affect vagus nerve function?
Yes. So again, so all those cranial nerves, which vagus nerve is one of the major cranial nerves, all start at that brain stem, which then have to flow through the atlas to come out, right? So that will definitely affect it. And the other point is, when I kind of mentioned this, but I don't think I hit it quite enough. When you have atlas misalignment, your cerebellum, which also has little things called tonsils, little nodules, will actually sink down into your neck, into that canal. The brain actually moves its alignment into that canal, which then puts pressure on your brainstem. And so not only were the cranial nerves been affected, but the brainstem will be affected, which will strongly impact vagus nerve function, which is what's supplying our heart, our gut, all the way down, longest nerve in our body, right? So atlas misalignment plays a huge role when I'm doing vagus nerve function tests and vagus nerve restoration with people.
Okay. So another question here from Jenny. Besides, I know you've already spoken to cranial sacral and chiropractic, what other types of professionals would be trained in these techniques?
Some physical therapists or physiotherapists are trained. You just have to watch out for the ones who are just using cookie cutter neck protocols or shoulder protocols. You want somebody who's actually assessing what's wrong and then applying appropriate rehab. But craniosacral chiropractors, upper cervical trained, some PTs, and some physiotherapists. And then, people in the regenerative medicine field who are doing PRP and stem cells, a lot of times are familiar with this work.
All right. Wow, we've got a lot of questions. I'm super excited. This one actually resonates with me right here. It's from Susan. Can you please discuss rehab exercises and sleep positions? Feels like I can never get comfortable no matter what pillow I try, and I wake with vertigo. I myself am a stomach sleeper, so it wreaks havoc on my neck. So I'm curious about that too. If there's something I can do to try to readjust my sleep patterns.
Yeah. So the rehab, I would start with all that stretching, right? Stretch the scalene, stretch the SEMs, stretch the pectoralis muscles. The two exercises I like the most on this front, kind of the old school chin tuck, right? So you want to sit real tall, okay? And then you tuck your chin. And then I add a little bit to it where you tilt up with the chin tuck. Tuck, look up, okay? And then the exercise, the other one for the shoulders, let me see if I can get in camera view here. It's called no money, okay? So you stand real tall, you pinch your shoulder blades back, and you go thumbs way out to the sides, just like that, okay? So here, pinch your shoulder blades down and back. So try not to stretch, try not to put too much tension on your traps. So down, back. And so somebody goes, you got any money? You go, no money, right? And you just hold that for a couple seconds, and you just do a couple sets of 10 like that. And that helps to stabilize the rotator cuffs, the rhomboids, which gives the neck a lot more stability. And then as far as retraining being a stomach sleeper, okay, that one, I do a lot of different mix work on that front if somebody was wanting to retrain that in a room. So I would probably start them from their stomach, and I would be doing a lot of manual therapies, slowly rotating them so their body can get comfortable in a different position. Okay, would be number one. And you could find a good massage therapist or physiotherapist or chiropractor to also work with you on that front, to where I could get them to their brain to acknowledge that they can sleep in a supine or side lying or on their back fashion. And then the other point I do a lot of work on that front is like childhood emotional work. Where do they develop sleeping on their stomach as a kid? And can we tell the brain and the inner child that it's safe to sleep in a different position? And so so in the meantime, though, on yourself, what you would want to do is when you're laying in bed on your back, you would want to basically go to bed a few minutes early, 5 or 10 minutes early, get the room dark and quiet, and then really focus on telling your brain where you're at. So really pay attention to feeling the pillow, trying to get your neck and everything to relax with the pillow. And if you need to change pillows, you got to change pillows. Okay. Because if you're used to laying on your stomach, it's not the same pillow you're going to need to lay on your back. Okay. And then you go down to your shoulders. Shoulders, do you feel the bed? And you let yourself relax. You're not just trying to relax them, but you're also trying to get the brain familiar with the position you're in, so it knows it can be relaxed in this position. You're having to reinform the brain body map. Okay. So side lying or on your back are both okay. And so that's what I would do though, is basically on your own, I would spend a lot of time reinforming that brain body map about where you're at. So improving what they call proprioception, and where your body's at in the bed, and then getting those muscles to relax in that position. And it probably is, it's probably going to take 30 or 45 days of consistent work to get it to reset. But what I also found is really helpful is in the morning after you've been doing that, is to go ahead and do those SCM and scalene stretches with the exercises afterwards, because your body's been in that extended motion.
Okay, great. My question was also, how long do we have to do these things if we're trying to adjust our sleep pattern? So thank you for answering that. So I'm looking into the chat now again. Did you mention earlier a resource for a DC who specializes in this, and can you provide the link?
So I'd have to go back through and pull the links up, but the organizations, which will be in the slides when they provide them, but it's Atlas Orthogonal, Advanced Orthogonal, Blair, Nuka, Activator. They all those organizations have like find a practitioner on their websites.
Yeah. Okay. And yes, we will be providing the slides to everyone and also the recording, just as a reminder there. Okay, how about from Robin? I would like to hear your thoughts on using the Alexander technique to change old habits of posture and bad body use to both address the root cause and develop new healthy alignment habits. And just to explain, what is the Alexander technique?
The Alexander technique, it's kind of a school of physiotherapy or physical therapy, but it uses a lot more breath work, mindfulness, self-awareness with that. So it's definitely not anywhere close to traditional physical therapy. And so you could definitely use it to retrain a lot of these patterns around holding patterns that are maybe pulling the atlas out, sleeping patterns like we were talking about a moment ago. You can use that. It's basically, I'll give you an example of like some walking patterns with Alexander. So if somebody has a walking pattern that's constantly throwing their hip out of place, you could use Alexander to be very mindful of creating a new functional gait pattern. So an Alexander therapist might take you through just a little bit of like raising the knee the right way and really doing it in a way that you can feel the difference in activation, notice it, and start to do it on purpose, so that eventually it becomes unconscious and you can just do it naturally.
Okay. Yes, I think there's so many things that we can be doing on our own to kind of adjust our or unlearn our patterning, for sure, with posture. That's what I'm gleaning from this. Can atlas misalignment cause excess fluid in the head, releasing in the head, ears, eyes, and sinus?
Yeah, so number one, it'll cause, so I talked about how the cerebral spinal fluid flow gets impeded. What happens with that is actually we get pooling in the brain, where you get cerebral spinal fluid flow that just sits in the brain and accumulates. And actually they can do scans on that where they show it just sits in pools sometimes for years and accumulates junk, iron, heavy metals, whatever. It just sit and accumulate calcium deposits in there. So it can cause excess fluid. Now, just like it causes excess sinus congestion, it can cause excess histamine because of all similar functions like that and inflammation, which will cause excess fluid, excess tearing, excess mucus, ear congestion, and then partially that eustachian tube, right? If you've got kids, you know about ear infections, the eustachian tube is so important. The alignment is big on having good drainage. Well, that atlas impacts how well those eustachian tubes drain.
Right. So much seems to be around this area of the body. It seems to have this domino effect, which is interesting about the next question. Robin asks, please clarify that the alignment of the atlas isn't a panacea, but that the entire body, as the entire body is integrated, also needs to be aligned. So can you speak to that? Is this not being the end all be all?
Correct. Yeah. So you wouldn't, So like if I work with someone on a structural perspective, I start with the atlas, but it's not where I necessarily end. So, and I'll start from the backside and then work my way up to her question. Is if I start with, let's say, the hips and then the thoracic spine, and I balance the shoulders and I balance the feet and all of that, but the atlas is still misaligned, all those things are just going to come back, because what's happening is neurologically, you're running into a neurological block. That's the brain is not telling the body to respond to that, because it's saying, hey, I've got this bottleneck up here of neurological information that's telling me that the spine is misaligned. And so all of that work is trying to force it back into place. What you start with is getting the atlas aligned, and then neurologically, the rest of the spine and brain will accept the rest of those treatments better. So for instance, I start with the atlas, then I work on the hips, then I work on the spine through, and then I work on the extremities, shoulders, arms, legs, hips, knees, feet, etc. And so you start with the atlas, make sure you basically undo that neurological bottleneck, and then every other bit of work you do will be easier and respond better from that front. So I think that answers your question. And in general, I want to make sure I answer that, like, just adjusting the atlas doesn't fix, all of your other chronic issues, but it will create a bottleneck of making it more difficult to get better if you don't correct the atlas.
Makes sense. Awesome. That was a great question. Are you how do you include homeopathic remedies to support atlas treatments?
Yeah, so sometimes I'll do homeopathy based on like connective tissue healing. So it might be homeopathics with dilutions of collagen, connective tissue, maybe some of the nutrients, maybe some of the bugs that have affected the connective tissue. I'll do homeopathic dilutions of those. And then there's different homeopathics, like Roostox is really good for inflammation, which is a good route on that front. Bambusa, which is homeopathic bamboo, is really good for the spine and building spinal strength. So I'll include some of those as potent suggesters. And sometimes I've done homeopathic dilutions of the atlas itself, right? Atlas bone, just as kind of like a harmonization, like to increase the frequency direction of what I want to do with that homeopathic.
Awesome. So many good resources here. So here's an interesting question. Katerina asked, can stem cells and PRP be directly injected into the atlas? And what's PRP?
Yeah. So PRP is basically, it's derived from your plasma, right? And so what they do is they spin your blood, they take the plasma out, which has a ton of healing properties. And that's what they inject in. That's the PRP. And so they don't direct it into your atlas directly, but they inject it into the ligaments directly that are attached to the atlas. So they have to go from different angles to do that, some through the back of the mouth, some through the neck, and etc. But they would inject the ligaments and muscles around it to help heal it. Mm-hmm.
And did you address stem cells?
Yeah, so the same thing. They would inject the plasma or stem cells and exosomes, especially for connective tissue. Exosomes are going to be a little more potent into the ligaments and connective tissue directly.
And what's that for again? What's the purpose?
That's if your ligaments are so stretched, like they're so hypermobile, and so you diagnose that with an X-ray or MRI, motion X-ray a lot of times, where you can actually see that what's happening is that atlas is sliding way too far one way or the other. So as they come forward and back, for instance, they'll see on the X-ray where you, instead of having a normal range, you slide one too far the other direction, which means the ligaments are holding you. And so when that happens, sometimes if you keep the atlas aligned, they'll heal on their own. But if it's from too many, like let's say car accidents, etc., you may need the PRP or stem cells to fully get those to retract and stabilize and get nice and tight again.
I see. Okay, great. Thank you for the clarification. I am just going down the list here. I'm aware of our time, so it's plenty of time here. Can you please talk about vagus nerve testing?
Yeah, there's multiple different ways to test the vagus nerve. Personally, in the office, we'll use like a vagus nerve stimulator or even humming. And then we'll use that with our biofeedback methods, whether that's kinesiology or frequency testing, to see if that creates a disruption in the body. But you can also look at things like heart rate variability. There's some deeper ways of doing, you can actually do some nerve conduction stuff, but that's pretty invasive. So usually we'll just do, is the vagus nerve functioning well? So hum, stimulate the vagus nerve, then see what happens to the neuromuscular system of the body. Does it falter when you try to stimulate it? That's my usual route for vagus nerve testing.
Okay, great. And that has to do with the first one of the earlier questions about having the atlas misalignment affect vagus nerve. Okay,
Correct. Yeah, a good functional neurologist would be able to help you test that too if you think you might be struggling with vagus nerve function.
awesome. And just to clarify, is there a particular frequency of how often atlas misalignment needs to be adjusted? Depend on the person, I'm sure.
It does depend on the person. If someone for sure has like upper cervical instability, a lot of times they'll start with 2 or 3 times a week because it's if it's the ligaments can't hold it in, you really want to try to keep it in while they're doing the rehab and the nutrition therapy and then potentially some PRP or laser injections, et cetera. PRP injections or laser work, maybe
Mm,
stem cells. And so, but every visit I'm having with an in-person patient, I'm checking the atlas. And so just to make sure, but on average, I would say if I'm just worried about it being apart, but not necessarily instability, I'm having patients go once a month.
okay, great. Another question is, what do you think about cervical traction?
Yeah, not so much for atlas misalignment, but for degenerative changes or disc issues in the cervical system, it's really, really good. It can be really, really good. And what they do is they'll do a little trial to make sure it doesn't aggravate anything. And if that's it, they'll create a traction plan for you. But if you've got degenerative changes or disc issues, gentle cervical traction can be really helpful.
Okay, perfect. Circling back to sleeping, do you have any recommendations on pillows for back sleepers?
Yeah, so I do like, it's not particularly like organic cotton by any means, but I do like the Serta orthopedic pillows. A smaller pillow is usually better. Very many of us have really thick pillows that prop our head up into flexion all night long. I actually, at our house, I sleep on a bath towel. I fold a bath towel. I can adjust it based on what I need, and it's the perfect height and soft. And that way, I don't have. Otherwise, I've gone through so many pillows trying to keep my neck happy that I found a bath towel works the best. But what often works great, and I've used in the clinic before on the table, is a Serta orthopedic pillow, and that one seems to work out pretty well too.
Awesome. Thank you. The bath towel's fairly cheap option too.
It is. Yep.
From Susan here, the next question. Can you talk about tinnitus and sound sensitivity related to the atlas? And are the same exercises helpful with
Mhm.
tinnitus?
The same exercises would be helpful, but the kind of the etiology, to use a fancy term, or what's the connection between the atlas and tinnitus or sound sensitivity is typically the way it's affecting the nerves. Okay, the misalignment's affecting those cranial nerves, whether it's the cochlear nerve or the vestibular nerve, auditory nerve. So all those are being affected and impacted via microinflammation and misalignment, creating issues on there, which can drive the tinnitus and then drive the sound sensitivity. And the other factor that happens is because, for instance, the eustachian tube gets blocked, everything gets more congested, the cerebral spinal fluid, the blood flow, inflammation and infections have a chance to ramp up, which also can impact that. So different infections can drive tinnitus, different infections can drive sound sensitivity. And then even it goes back to the central system, right, in the brain, because then our stress response pathways, our motor cortex, our sensory system, our thalamus, all of those are impacted by the atlas. So all the sensory input coming in and going back out is also impacted. So it's both local and central that it's being affected for things like that.
Awesome. Okay, great. And next question. For all the symptoms that are attributed to the atlas misalignment, which one of these could actually be caused by a different vertebrae downstream?
Yeah, so all of them could have a different vertebrae impacting those areas for sure. And what I would say is a good atlas chiro would check the atlas and then go through and check and make sure they don't have to do any more work with the rest. Here's what I will say though, is a lot of times if I can get the atlas aligned, any other work becomes so much easier. So if I have to adjust the rest of the neck, it's much simpler, but I find I need to adjust the rest of it a lot less. Whereas like if I just started with plain old typical palpation, I might need to adjust 4 segments. If I adjust the atlas, I might need to adjust 0 or 1 afterwards. Or what I found is actually just stretching after the atlas adjustment. A lot of times will clear out what's coming up from the rest of it. Now, that's not the same as necessarily as somebody who's got a disc herniation or they've got degenerative joint disease in the neck that's impinging the nerve at like, let's say C6. So atlas is C1, C6 down low, maybe creating impingement. But regardless, whatever work you're going to do there, you want to make sure the atlas is in place first.
Awesome. So Samantha asked, a naturopath once told me that my structural adjustments wouldn't hold until I stabilized my adrenal fatigue. Do you agree?
Yes, to some degree, but it's the major factor there is how your minerals going to stay balanced, is what your adrenals help do, and what your cortisol going to function like, because that cortisol will degrade your connective tissue. Okay, it makes the bones, joints, connective tissue weaker. So when you've got adrenal issues, it's going to be a problem in order to stabilize that. But regardless, while you are working on healing your adrenals, you'd still want your atlas to be in check. That'd be like saying, okay, I know that I'm having to drive through a construction zone sometimes and it's giving me flat tires. Maybe I shouldn't replace my tire until I don't have to drive through a construction zone. Well, no, you still need a tire to drive on while we're dealing with getting the nails out of the construction zone.
Okay, great. That's a good analogy.
Thank you.
So Jenny asked, and are there any connection between this and the COVID vaccine?
So here's what I've seen with that, and I want to be really careful here so I don't get canceled. But it's the vaccine is causing a lot of head pressure issues, okay? Because it's causing a lot of. I actually have a case I just took on this past week who has got intracranial hypertension, increased pressure in the brain and cranium due to post-vaccination injuries. And so what happens on that front is the atlas becomes imperative as you're dealing with the cause. So the cause of that would be the vaccination injury, right? The clotting factors, the immune regulation, etc. And so you have to deal with that cause, but you want to keep that atlas open so you can actually drain that head, right? And so the other thing that's going to happen there is that people are having, for instance, mast cell flares, or we know it can reactivate EBV or other infections with it. And so when that happens, that's all going to infect the atlas and connective tissue as well. And so kind of on both ends, you want it to be a part of the treatment for the vaccination injury, and the vaccine can injure the things that cause atlas misalignment.
Okay, great. There is a question here. I'm also checking in on our time, so we still have plenty of time. Are there any muscle response testing methods we can do at home to determine if areas are out of alignment or need adjustment, if our atlas is out of adjustment?
Yeah. So I would say, kind of like the disclaimer we had earlier, but this is just for informational purposes only, right? This is not a diagnostic method. It's just a way to kind of get some information about your body, and then you do with that what you will. So personally, some of the things I'll teach some of my clients and patients is to self-muscle test, a muscle response testing, right? It's a self-muscle test, either testing a finger. So we would say you're testing the index finger right in the middle there, right? So you can learn to test that way. And so you would, if it's strong, nice and strong, you can't push it down, okay? And so you could simply just scan an area with the other hand, okay? And if it's suddenly, oop, I can't keep it there, I would know there's an issue here where my other hand is, which would be near my upper cervical, my atlas. And so that would tell you, I do know I have an issue here in that region. And you could try to use a little bit of some mental challenge questions. That gets a little bit more difficult, but that's one major way. So you're trying to hold that finger. So with the middle finger, you're pressing down on the forefinger, pushing real tight. If there's no issue, we know it's okay. And if it either falls off, we call it a flick test, or it goes weak, right? You can't hold the muscle up, either one. There's an issue there. So apply pressure. We're strong, strong, strong. A little weakness, right? Or it goes weak. Okay, there's an issue where I've got my other hand. That's a really simple way there's ways to get a little deeper. You can do some verbal expressions. Is my atlas misaligned? Strong is true, weak is false, etc. To help you acknowledge it. There's some different ways to use hand modes to help to tell that. But that's a really quick way to go, okay, is there an issue here?
Awesome. Great. Okay, a couple more, and we'll be able to wrap it up here. What is the impact of heavy teeth grinding on the atlas? That's a good question.
Yeah, I found atlas misalignment number 1 will contribute to teeth grinding. Okay, and the couple of things I do with teeth grinding is because I create so much tension there that it's changing the jaw dynamics. It's actually changing, it's changing the levels of your teeth.
You're
Right, it's
just
grinding
your
your teeth
connection just got a little weak,
down
but we've got
a
it
bit,
just barely.
and so that's going to impact the atlas back and forth, right? So number 1, number 2, it can go back and that tension there can throw it out. Oh, okay. Back now. Okay. So, oh no, it is getting loud. Basically, the teeth grinding. Can you hear me?
Yes, in
Can
and
you hear me at
out.
all yet? Uh-oh. Okay. I'll
Oh, you're
try.
back.
If not, we
You're
might just have
back.
to. Okay, awesome. So all that tension from the teeth grinding can definitely throw the atlas out. And it's also going to change the dynamics of your teeth because you're grinding your teeth down. And so all of that will change the motion of the jaw, will change the muscular tension, which can throw the atlas out. And that atlas being out will increase muscular tension. The other thing I find with that, and a good craniosacral therapist or a old school osteopath or someone trained in cranial work, is that cranial fixations, either connective tissue or on the sphenoid bone, will also heavily impact jaw grinding, tooth grinding, right? And then you want to look at, it's called bruxism when you do that, when you grind and tension, but you want to look at parasites. That's a biggie that'll cause that teeth grinding at night.
All right. So we have time for one more question, and then we'll wrap it up with some information for everyone. Is there a connection between atlas misalignment to Chiari malformation?
1,000%. Okay, atlas misalignment has been shown to cause Malchiari formation, right? And that's actually kind of what I was talking about, where that cerebellum dips into that foramen, into that spinal canal. They call that Malchiari. That's where the cerebellar tonsils, part of the brain, basically the back of the brain, dips in there. Some of that can be genetic, but regardless if it's genetic or like trauma induced from the atlas misalignment, you want to keep that atlas secured. And so with some of my genetic Malchiari patients, what we'll do is we'll get an assessment. It's like, let's say they have it's called a Malchiari 2, which is a moderate Malchiari. It's dipping further into the canal. We'll adjust the atlas, work on keeping adjusted, redo the imaging, the MRI or the x-rays, and then see, does it reduce to a Malchiari 1 or 0? Then we know we're on the right track. And so definitely it can be a treatment, and atlas misalignment can cause Malchiari malformation. And so also you want to look at craniocervical instability. So if your atlas is out so often that your brain is dumping into that canal, you probably have upper cervical instability.
Wow, that's awesome. Thank you so much, Dr. Hart, for all this wonderful information on atlas misalignment and then some. That wraps us up for today. We have some closing announcements. First of all, our next BioBites is in April. It is on financial challenges and mental health. It's understanding the correlation between financial health and mental health. And also, as a reminder, we will be sending out this recording. We will be sending out also supplemental information plus the PowerPoint presentation as well. And lastly, I'll pass it on to Liz as she has an announcement to make.
Yeah, thank you. Thank you very much. Dr. Hart, always a pleasure to have you on board here. That was wonderful. And I don't think we've ever had so many questions during a BioBites before. That was a good one. I did drop some things in the chat log for people to check out. I don't know if everybody saw it, but one, I wanted to let people know that we are partnering with the Omega Institute this summer. This is really exciting. We're going to be doing a weekend-long workshop on biological medicine. And so if you are an avid BioBites participant and you want more information, this is going to be a weekend with Dr. Tom. Dr. Tom has been on BioBites many times. He's an excellent teacher. He's going to be teaching about how to incorporate more of this into your life, how to learn more about your body, and how to work with practitioners to get more of this, in your healthcare. So that will be great. And then I also posted that if you are on here and you are a practitioner and you're interested in looking at how you can bring biological medicine into your practice, we do have a certification course for you. There's an introduction to biological medicine, and that's really just for anybody, but there's also a certification course for practitioners, which is a little more in-depth and really goes into the diagnostics and the therapies associated with it. So both of those, I put links there, but if you are looking for more information on those two programs, feel free to reach out to me. It's liz@marioninstitute.org or to my teammate Jessica at jessica@marioninstitute.org. And we look forward to hearing from you and seeing you next month. Thank you.
That was great, everybody. Bye.
Thank you so much. That was